All right, welcome. I get the privilege of kicking this off. My name is Pete McWaters. I'm the Director of Ottawa County Central Dispatch. Captain Tenney with Holland Fire wanted me to remind everyone that this is an active fire station. There might be a call that goes out like we just had a couple minutes ago, but we should be able to push on forward and get on through. Again, Pete McWaters. I'm the Executive Director at Ottawa County Central Dispatch. Happy to be here this morning to discuss PulsePoint with you. Several months ago now, we were approached by HeartSafe Holland with this project, and to be quite honest, we didn't know a lot about PulsePoint. So we talked through it, we got the information, we were given some resources in terms of looking into other entities, both in the state of Michigan and around the country, and we did that. And I can tell you we got nothing but positive feedback from both first responders and community members that are utilizing PulsePoint. It's been quite the project in terms of integrating with all our systems, but I'm happy to report we've been able to do that. You know, every day at Dispatch we take hundreds of calls, literally, from people that need help. And then we decipher what they need, determine what type of help they need, and then partner with our very professional, very active police, fire, and AMR, life ambulance companies, North Ottawa, and provide the resources that they need. And with this, we now have a force multiplier with citizens that are going to be involved. For citizens that sign up and are going to get these PulsePoint alerts, they're going to be in a position where they can perhaps respond quicker than even first responders. And as we know, with sudden cardiac arrests, seconds count. And if we have someone close by that is willing to help with a sudden cardiac arrest in a public place, they are going to potentially beat our first responders there and potentially save lives. I'd like to thank Holland HeartSafe for initiating this project. It's been a lot of work. I know there's a lot of fundraising that went into it, a lot of planning. I'd also like to thank one of my employees, Ryan Culver, who was actually supposed to be here today, but he is home with a sick family and sick kid, and he sounded pretty sick when I talked to him this morning. But he really did a lot of work. He was the lead on this project, and he was able to come back to me and explain things. And I really, to kind of conclude and sum it up, there was no downside to this project whatsoever. It's all positive, and of course, if you save one life, everything we've done is for the better and worthwhile. So very happy to be involved. Again, thank you for the people that were involved in the planning and the fundraising for this project, and we're happy at Ottawa County Central Dispatch to be a part of it, and looking forward to it being operational here as of today. So, and one other thing real quick, we have thus far 14 fire departments and communities that have signed up. Our Life AMR and North Ottawa Ambulance have signed up for the professional version, so it's really taken off even before it started. So full steam ahead, and we're happy to be involved. Thank you.
Buenos días, yo voy a estar en cargo de la traducción al idioma español para esta reunión el día de hoy. Como se acaba de empezar a mencionar, la tecnología ha venido a revolucionar la manera en que vivimos. Cada vez vivimos en una era más conectada al internet, donde no requerimos de estar necesariamente en contacto con todas las personas que tienen conocimientos. A través de esta aplicación lo que se busca es ayudar al equipo médico para poder tener una red más amplia de ciudadanos que tengan el conocimiento de cómo poder apoyar a aquellas personas que entren en situaciones de paro cardíaco y no estén en contacto o dentro de una red de hospitales. Quisiera agradecer al equipo de HeartSafe Holland. Este comité, a través de su generosidad, han aportado la tecnología de PulsePoint, y a través de esto van a brindar mucha ayuda tecnológica para poder salvar vidas en todo el condado de Ottawa County y sus residentes. Gracias.
Good morning. My name is Chris Tinney. I'm the Captain of Fire Operations with the Holland Department of Public Safety. Like previous speaker, I want to again thank everybody for being here. I'm honored to be here. Thank you for the invitation from HeartSafe Holland. I want to acknowledge just some of our community partners, AMR. We put this EMS program on the road in our community, and we can't do it alone. So everybody that pulls together here, and we're going to talk a little bit more about how the public, how we can engage those through this app and those citizen rescuers. Special thanks to Heart Safe Holland and the project team for your efforts to bring this program and bring it into our community. I also want to continue to encourage their efforts to make Holland a heart-safe community. Great work. I don't think everybody can understand or fully understand the amount of time and dedication that has gone into that, and we are certainly going to derive the benefit from that. We have some case history in Holland with citizen CPR, and I think that's important. This will make that stay. This will make this a bigger asset to the community too. I also want to thank Angela Lound. She's our agency representative on the Heart Safe Holland project team. Her efforts, I've just been able to see so much of what she's been doing, and again, I think we're honored through her efforts to be a part of that team. I want to start out, we'll talk a little bit about the problem. And according to some 2016 data from the American Heart Association, it's about 350,000 cardiac arrests across the country every year. That's probably gone up. I don't know, I can only imagine. We're not getting healthier as a society. So of that 350,000, 12% of these people actually survive the event. That defines the problem. What we do know is that immediate CPR, access to AEDs do make a difference. What PulsePoint is going to do is going to activate those earlier parts of the chain of survival. And we know the chain of survival is early access to 911, early access to CPR and defibrillation. It's early access to ACLS and ALS transport to a hospital. The last part of that is actually the clinical part of that in a fixed setting where we're actually rehabilitating people that have been resuscitated in the field. So ultimately, we want to get that person to the hospital. PulsePoint is going to be a key tool in helping us do that. Today, we're here to kick off this application, which will facilitate the first two links in that chain, their early access to the system, and then early CPR and defibrillation. We know this works in Holland. Every year, we have the opportunity to recognize efforts in the community by our department through our partners, our response partners, of life-saving events that occur. We have cardiac arrests that do occur. We have people that walk out of the hospital. While we may not always recognize the details or remember the details, we recognize these people by their names. Norman, John Shea, one of the committee members, is a prime example of a beneficiary of early CPR and intervention. And then we have Norma. So we remember that. These do occur. And these occur because we have people that are trained in CPR that are willing to act and get involved. Those are the commonalities. And again, PulsePoint is going to be a great tool in enhancing that. All these were possible because we had people in the community that knew CPR and were willing to move forward and jump into action. PulsePoint will serve as a tool to decrease the gap in time that it takes for us to get to the scene. Between AMR and the Holland Fire Department, at least in the city of Holland, we've got a pretty good response time. But we do know that brain death or irreversible brain injury can start to occur within 4 minutes of the cardiac arrest. So we want to enhance our response capabilities. PulsePoint gives us a tool to do that. PulsePoint will speed up that sequence. Okay. PulsePoint, by the way, is a free app. I don't know how many apps are out there that are always free, but this is a free app that will make a difference. The Responder app will direct people to a cardiac arrest within a geo-fenced area, put them into action right away. There's another component to this. It's the PulsePoint AED app. This community can get involved with identifying where these AEDs are, and we can create a registry. So we know that we've got tools within that response area to go to work and, again, increase those positive outcomes. This app also is going to be made available to all EMS responders within the County of Ottawa. The EMS Responder app, as you know, there's a lot of responders in the room. How many people actually go home and turn that off? Once you're a responder, you continue to do that. It's a 24/7 job. If I'm in an area, I know some of my coworkers, we happen to be on 8th Street and we're having dinner with our family and there's something that goes on, we would feel really bad if we weren't aware of what was going on. So that's an app that's going on my phone. I would encourage everybody, other responders, to do the same. In conclusion, again, I want to thank everybody for the opportunity to be here. There's a lot of work that went into this. Again, the donors, the Heart Safe Holland project team is just continuing to march forward and do what they're doing. It's a lot of work. I would encourage anybody that's out there listening to this that if you want to learn CPR, you step up and do it. It's fairly easy it's a fairly easy skill set to learn and maintain, but it does make a difference. And we've seen that in Holland. Again, I gave you a list of those names. And those are recipients of those people that are willing to step up and learn. The other part of this is download the PulsePoint app and make sure you can get that notification. So I think, again, this is a great tool. I hope to see it be put to good use. Again, as Mr. McWaters had mentioned, we've seen this, we're going to see this in place in a number of fire departments throughout the area. A number of communities are going to adopt this and push this out to their community members as well. So again, thank you, and I appreciate the opportunity.
Tristemente, hay más de 350,000 personas a lo largo de cada año que sufren de algún paro cardíaco y no están dentro de un hospital. De estas 350,000 personas, menos del 12% sobrevive. Esto quiere decir que más de 300,000 personas fallecen a partir de paros cardíacos cuando no hay personal médico calificado alrededor de ellos. Por esto es que es tan importante la tecnología de PulsePoint. A través de esta tecnología se busca que los ciudadanos unan esfuerzos con aquel personal médico de primera línea para poder salvar a estas personas que necesitan ayuda y no están cerca de personal médico calificado. Este departamento de bomberos y su jefe invitan a la población a poder descargar esta aplicación gratuita que está disponible en todas las tiendas digitales, ya sea para Apple o Android, y para poder acceder a esta tecnología que puede salvar vidas. La aplicación también está disponible en el idioma español. Si cuenta con su dispositivo tecnológico en el idioma español, la aplicación será descargada directamente en este idioma. El departamento de bomberos de esta ciudad está comprometido a tener esta aplicación también descargada en sus celulares, lo que quiere decir que aunque no estén de turno, podrán tener acceso a esta información en tiempo real para saber si necesitan acudir a una persona que está requiriendo de auxilio. Nuevamente, es una alianza muy importante entre tanto los médicos y los ciudadanos, ya que se necesita de mucha más gente. Mientras más gente activa esté en esta aplicación, más probabilidad hay de poder salvar vidas. Así que los invitamos a todos ustedes que están viendo esto a poder descargar esta aplicación y unirnos en el esfuerzo de salvar vidas. Gracias.
Good morning. I'm John Kramer. I am an EMS physician and have the honor of working with all of these folks as the medical director for this program. Thank you so much for joining us this morning. We are really excited about the program, the opportunity that it provides us, and thankful for the partnerships that we have been able to establish. One of the things that hasn't been clarified, I don't think so far, is a special thank you to the City of Holland and the Holland Fire Department for providing the administrative support and serving as the lead agency for this project. The project is focused on cardiac arrest survival, and that is critically important. But I would offer that it's going to help improve our overall medical response capabilities throughout the City of Holland and ultimately throughout the entire county. Now, I don't have any vested interest in the PulsePoint program other than it's really great. PulsePoint as an organization is unbelievably committed to this program and response for cardiac arrest, and Shannon will talk a little bit more about that in just a couple of minutes. The PulsePoint program, the protocols and the information that have been developed in cooperation with the American Red Cross. They're consistent with American Heart Association guidelines. It's sort of incestuous because the PulsePoint app has a link to Red Cross resources, Red Cross first aid resources. The Red Cross first aid resources also link to PulsePoint. So there is really a very symbiotic relationship there. One of the things that is extremely helpful with the app is that it includes specific CPR instructions, okay? Folks are trained when a cardiac arrest happens, you know, your pulse goes up a little bit, your breathing goes up a little bit, and muscle memory goes away. So the app helps you in CPR. It's also important for folks to understand that the critical tie-in with the 911 system is when you call 911, the telecommunicators will also talk the caller, the responder, through CPR. So you have that added reinforcement that will come from the 911 center. Obviously, learning CPR is critically important, as has already been talked about. There are all sorts of programs that are available throughout the city and the county. This particular program has hands-only CPR instruction tied in with use of an automated external defibrillator. For folks that require formal CPR certification, like healthcare providers, industry responders, and things like that, the Red Cross, the Heart Association, and other organizations offer the formal CPR certification programs. But the hands-only CPR is critical for the community. You can learn hands-on CPR in probably 5 to 10 minutes. We'll tack on another 5, maybe 10 minutes if some people talk a long time as they're describing it, to learn how to use an automatic external defibrillator. The hands-only component of compressions is really critical. We have learned over time that the body retains enough oxygen when the heart stops that you've got, depending on the person, 3 to 4 to 5 minutes of adequate oxygen in your bloodstream. So doing hands-only, compressions-only CPR will circulate that blood, will circulate the oxygen to the brain and heart and other organs to help keep the person alive until an AED is available, either by citizens or by first responders, or a manual defibrillator on the part of ALS crews. So citizens don't have to worry about they're going to teach me how to do mouth-to-mouth resuscitation, and that means I'm going to have to kiss, is an affectionate way of referring to it, a victim who's in cardiac arrest. No. Our focus now is on just doing the compressions. I also want to make a quick distinction between cardiac arrest, which is the focus that we have with this program, and folks who have a heart attack. Heart attack is when people have an inadequate oxygen level in their blood and to their heart. The heart keeps beating, but it doesn't have enough oxygen, so you develop the pressure or the pain, you develop the numbness or tingling in your arm, the lightheaded, dizzy, nausea, those kind of things. That's a heart attack, meaning patient has to be evaluated and treated within a number of minutes. You don't want it to be delayed. A cardiac arrest is when the heart stops. It just doesn't circulate blood at all. The individual is standing there or sitting, talking to you, and they go unconscious, unresponsive, they stop breathing. Well, they may have a couple of gasping breaths, but the heart is pumping no blood. That's where we want to provide CPR and an automatic external defibrillator. Whoops, I timed out. In case you're wondering, Holland City PulsePoint is, as of this morning, up and running. So we want to take advantage of this. Obviously, we're thankful to Central Dispatch. He underestimated the amount of technological work that is involved in merging the program with the computer-aided dispatch and with some other things. It takes a fair amount of work, but Ryan Culver, as he mentioned, did a phenomenal job with that. So thank you to Central Dispatch. Without Central Dispatch, this wouldn't work. Thank you to the first response agencies, to the ALS agencies, and please help us go out and spread the word. You can learn CPR very easily. We will hopefully very soon have a directory that actually exists now and is building of where AEDs are located. And PulsePoint is a way to tie the community in with the healthcare community. Thank you.
Muchas gracias. Quisiéramos hacer un especial agradecimiento a la ciudad de Holland por todos los esfuerzos a los que han requerido, tanto en el área de tecnología como financiamiento, para poder tener esta tecnología en nuestra ciudad. Queremos invitarlos a todos, no solo a que descarguen la aplicación, pero sino que se acerquen a su oficina más cercana de la ciudad para poder inscribirse a cursos de reanimación cardiopulmonar o CPR. En estas sesiones no tardan más de media hora. Y en esa media hora podrán aprender cómo salvar vidas. No solo van a aprender acerca de los procesos de CPR que consisten en pulsaciones en el pecho firmes y rápidas, sino también van a aprender a cómo utilizar un aparato AED, también conocido como un fibrilizador eléctrico automatizado. Lo que hacen estas herramientas es que facilitan ayuda a aquellas personas que están en arrestos cardíacos para que puedan tener ese tiempo que el oxígeno siga llegando al resto del cuerpo y que se compren esos segundos, esos minutos que van a ayudar a que los paramédicos lleguen al área y puedan ser salvados. La aplicación PulsePoint lo que busca es poder entrenar a ciudadanos para poder salvar más vidas y comprar ese tiempo de respuesta que va a facilitar a los paramédicos a poder llegar al área y que esta persona aún tenga un chance de vivir y que ese 12% que sobrevive pueda aumentar a un número muchísimo mayor. Los invitamos a que se inscriban y que busquen estas oportunidades de aprender cómo hacer CPR y a utilizar los equipos médicos de AED. AED se ha probado que puede salvar vidas y la comunidad de Holland está facilitando estos entrenamientos, así que por favor acérquense y inclúyanse a este esfuerzo de salvar vidas. Quisiéramos también hacer la diferencia entre arresto cardíaco y paro cardíaco. Durante el paro cardíaco el corazón aún late, por lo que quiere decir que hay minutos para que el equipo médico pueda llegar y salvar vidas. En el arresto médico el corazón deja de latir por completo, por lo que solo hay segundos. Y de aquí viene la importancia tan grande de que nosotros podamos saber como ciudadanos cómo atender a nuestros co-ciudadanos que pueden estar en emergencia para poder ayudarlos. Gracias.
Hello, my name is Shannon Smith. I'm the VP of Communications for the PulsePoint Foundation. As a PulsePoint team member, I am thrilled to see Ottawa County joining the 5,000 other communities in North America leveraging PulsePoint technology to increase community engagement in out-of-hospital cardiac arrest response. As a West Michigander myself, I can't wait to meet the person whose life will be saved by CPR and AED intervention because a CPR-trained citizen responding to a PulsePoint alert here in Ottawa County existed. PulsePoint works by integrating into the county's 911 dispatch center. When a call comes into 911 indicating CPR is needed, the dispatcher automatically alerts first responders while simultaneously sending out an alert to anyone who's opted into CPR alerts and happens to be within a quarter-mile or 2-block radius of the patient. The idea is that someone could be on the floor above or the business next door and be close enough to maybe help someone, but far enough that they don't know that something's happening. And they are able to provide life-saving CPR or shock from a defibrillator prior to professional first responders arriving on the scene. But because today is Heart Month, or because this month is Heart Month and today is Valentine's Day, it perhaps makes more sense to explain how the app really works in a real-life scenario. Just a couple days ago in Oregon, they held a press conference to celebrate the survival of a 36-year-old mother, wife, and marathoner who was out training one day and suddenly collapsed. She went into cardiac arrest. A passerby initiated a chain of survival by calling 911 and when he discovered her feet sticking out from a nearby bush. The 911 operator guided him through CPR while also alerting first responders and sending out a CPR needed alert to citizen PulsePoint responders. One of those PulsePoint responders happened to be an off-duty firefighter who lived only a couple doors down from the incident. He was able to quickly make his way to the patient where he took over from the bystander and administered high-quality CPR until paramedics and his teammates arrived on scene. That woman's Apple Watch indicated that she had been without a heartbeat for 13 minutes. But because of the early intervention by bystanders, she left the hospital alive and without brain damage. It is her story that continues to propel the foundation forward, engage communities like this, so that we have more survivor stories and less statistics. Thank you.
Because Shannon was a fill-in for Ryan, we didn't think it was fair to throw that on JP to figure out how to translate that in a short period of time. So this is one area he's going to skip. My name is Jay Peters. I'm a volunteer in the project. A year and a half ago, a group of volunteers came together to bring the Heart Safe Community designation to Holland. This included representatives from the fire department, retired and current emergency response personnel, physicians, Evergreen Commons, Holland Hospital, Ottawa County Health Department, Hope College, Holland Rotary, and individuals who have saved a life, as well as those who had been saved by the type of training this program provides. Through this process, we quickly became aware that PulsePoint technology understood the potential of this technology. We also realized that the boundaries of PulsePoint technology would exceed the boundaries of the Heart Safe Holland designation, since our 911 system is coordinated countywide. This was not a problem. Through the efforts of seeking Heart Safe Holland designation, we're talking today about the potential for roughly 300,000 residents in Ottawa County and emergency response personnel to have access to this life-saving technology. There's just a few people I'd like to recognize that actually help really make it happen with providing resources. I'd like to recognize the Jury's Family Foundation. Jim and Cheryl Juries were very quick in understanding of the importance and made a great contribution to make this happen. The Makatawa Area Coordinating Council's Community Enhancement Program, which is a designed fund for these very strategic regional initiatives. It's not a Holland thing. This is ultimately, this Holland initiative is going to create something that affects everybody in Ottawa County. Members of that CEP group from the Coordinating Council, Holland Township, Park Township, Laketown Township, the City of Zeeland, and City of Holland all contributed to a fund that helped make this possible. Lastly, I'd like to thank the Holland Rotary Clubs for their leadership and the partnership that they've given us. We are a 501c3 because we fall under their auspices, and they've been a great project partner to date. In fact, I think we might have something here.
Good morning, everyone. I'm Linda Falstad, and I happen to be with the Holland After Hours Rotary Club, as well as the chairperson of Rotary District 6290's Grants Committee. And I'm pleased to present, on behalf of both organizations, a check for $4,220 to Heart Safe Holland. I'm proud and excited to be part of this initiative.
We're proud to have you.
Congratulations.
Getting close to the end here, I would like to also express our gratitude to Angela Lown for her exceptional professional guidance to this project since its inception. And I want to thank JP from Hope College for providing the translation that we've had today. I think that's important. 25% of the people in the city of Holland are Hispanic. I think that's only an appropriate thing to do for everything we do. With that, I'd like to call up Lisa. I happen to be someone who saved a life only because I was trained 2 weeks before it happened. It's an honor to be able to say you saved somebody's life. But I think it's even greater, the gratefulness comes even more from the person that was saved, evidenced by the fact that I think I've gotten 6 bottles of bourbon from John over the last year or so, and I'm grateful for that. So it all works out. But it was so easy. It was a half an hour. It's training on the mannequins that we have that will tell you if you're pushing hard enough and you're pushing fast enough, the light will light up and you get that feeling of what it's like. You never know when the person next to you, or in this case, 3 doors down, close in your neighborhood, goes down. Don't be afraid. Get over there and save their lives, because if you do it, there's a very good chance they'll survive with a high quality of life when they're done. Lisa?
My name is Lisa Cardillo. I am a resident of Holland and a volunteer on the Heart Save Holland team. I'm able to stand here right now because of CPR and an AED. At the age of 36, I survived a heart attack and a cardiac arrest. Never in a million years did I think cardiac arrest would happen to me. I was young, healthy, female, no underlying issues, no family history. I was the least likely victim. But that's the thing about sudden cardiac arrest. It can strike anyone at any time without warning. I was fortunate enough to have symptoms of a heart attack prior to my cardiac arrest, and I was able to get myself to the right place in the nick of time. My husband Dominic and I had just checked into a bed and breakfast in Granville. Soon after, I began experiencing sudden and severe heart attack symptoms. We got in the car and drove towards Grand Rapids. He pulled up in front of Butterworth Hospital, let me out in front of the emergency room doors. I walked myself in to check myself in, and that's when I went into cardiac arrest standing up. Immediate and effective CPR, followed by 2 defibrillator shocks, brought me back and gave me the opportunity to fight for my life for 4 more days. 9 days later, I was able to walk out of the hospital. Because my bystanders had a CPR and AED training, my kids are still able to have their mom, and my husband is still able to have his best friend. It feels amazing to be a survivor living in a city that's as committed to saving lives as Holland. With the addition of PulsePoint, I know more lives will be saved and make Holland the safest place possible for our community members and our many visitors. This concludes our press conference. I just wanted to thank you so much for coming, and I'm so grateful to be here.